Emergency, you require police, fire, or ambulance.
When you dial 911, it goes to a call center. The Toronto Police Service runs the call center for all emergency response in the City of Toronto. This call center transfers calls to fire, police, ambulance, or alternative responders and takes the police calls. It also responds to the police non-emergency line and dispatches police when needed for calls to both lines. The call center receives over 1.8 million calls a year. About 1.1 million of these are to 911, and over 700,000 are to the police non-emergency line. It's vital that 911 calls are answered quickly. The call center aims to meet the industry standard and answer every 911 call within 15 seconds, 90% of the time. The call center did not meet this goal from 2018 to 2021. Other jurisdictions are also challenged in meeting the time frame required by this standard. To understand why, we dug into the data. We found that when you call 911 impacts how long you wait for the call to be answered. The peak times are usually between 10 a.m. and 10 p.m., which is when the call answering times are generally longer. On average, call answering times during peak periods were trending at about twice the standard. The average wait time varied significantly throughout the day. As you can see in this graph from 2018, the darker the bars, the longer the wait time. On some days at peak times, the wait time was 8 minutes or longer. Call volume and staffing levels have the biggest impact on the call answering time. The call center operates on a demand-based model. That means the call volume is determined by the public who call 911. Every call gets answered, and callers who hang up before they get an answer are called back. Staffing levels are the main lever to keep the call answering time down. While it's extremely important to have good data and information to plan staffing levels, the call center doesn't have the data and modern information systems it needs to effectively plan its staffing levels and monitor its performance to better identify which calls could be suitable for alternative community-based responses. TPS is implementing a new system for next-generation 911 that will allow callers to contact 911 by text and video, in addition to traditional phone calls. This won't automatically fix the issues. TPS needs to ensure the data it needs is identified and included in its data strategy and information systems. Operators have a difficult and stressful job. There was a high rate of daily absences for sick time combined with an increasing number of staff injured on duty, resulting in fewer available staff. This can lead to increased overtime hours for some and can impact their well-being. TPS needs strategies to address staffing issues and to improve the operator's health and well-being. TPS may also need more staff to be able to meet its service standards, particularly during peak periods. While the 911 number is for emergencies, we found that non-emergency calls made up almost 60% of the total calls to 911. About 1/3 of the non-emergency calls were abandoned calls and pocket dials, and operators must call them back. To reduce non-emergency calls, TPS and the city need a public education campaign about calling 911 when it's an emergency and non-police or non-emergency numbers to contact. Our report also found a need for improved clarity of the operational manual, technological supports, and additional training to better support operators for the call center. A need for all police officers to indicate their availability for the next call to help reduce dispatch wait times, and the importance of funding 911 operations, including NG 911. The Auditor General has made 26 recommendations in 5 key areas to further improve the 911 operations and its ability to help keep Toronto safe. TPS has committed to implementing all 26 of them.